Nice to meet you, and it's a pleasure to work with you. I'm excited. This is quite the honor.
Likewise.
So, you want me to go first?
Yeah, sure.
Yeah. First and foremost, Corinne, thank you for the invitation. It's very much appreciated. This is exciting to meet so many bright and energetic people. I'm looking forward to the pitches, and I will pay close attention for opportunities for collaboration with the Cleveland Clinic. You know, the part that was most interesting to me is when I look at your pedigree and I consider my own, I realize we started in two fairly divergent areas of medicine, dermatology and orthopedics. I would think you couldn't get too much more divergent. But what's interesting is that our careers converged in a very, very similar way through our own sort of entrepreneurship, our own inventors, but then we spent a lot of, my current role, your current role, is how do you bring innovation in healthcare, in hospitals, which is a pretty complex environment. So, you know, I guess my interest is we're going to probably share some mutual interests and mutual experiences in how innovation and healthcare kind of come together. Particularly not so much healthcare as a university, but healthcare as a hospital, which is a different environment than healthcare as a university. So I'm just wondering what your thoughts are.
Yeah, thank you, Joe. So I think that there is of course not one recipe to achieve that goal. But when I look at the people that Karin has succeeded to gather here, I think that there is one very important part of the recipe which is actually relevant to the people who are sitting here. Everybody here is using the word disruption every second sentence. And many things have been disrupted, our understanding of what an image means, how do we approach patient journey, etc. There is one thing which remains to be disrupted, and this is the health system culture. If you look at, for example, I'm a dermatologist, and last year there is a AI-based technology which has been shown. There was a Nature paper about it showing that a machine can diagnose melanoma much better than the best of the dermatologists. Has dermatology been affected by that? Not at all. Everybody is continuing doing the same. I guess that many of the people are going for their mole check to their dermatologist, and I'm sure that many of you know of this machine. So disruption has been happening in many places, science, innovation, industry, etc. The only place where disruption does not happen is actually the only one which is really relevant to what we are all looking for, which is bringing a better health to the public, and it is within the health system. And our own recipe in my hospital, in order to try to remedy to this problem, is actually a culture of openness. So as we speak, at this very moment, there are approximately 100 startups which are working within the hospital. I'm not speaking about the contracts that we have with many, many startups outside the hospital, but there are 100 startups with their employees who are plugged in on our machine, working within the hospital. And the encounter between those people, this culture, and our people, their culture, is slowly but surely leading to this disruption. I think that we should therefore see this gathering as an opportunity to partner in order to try to see how do we better integrate our efforts, the health system and the industry and of course the academy as well.
Yeah, just to follow up on that, I think if you look at certainly healthcare in the United States, there are multiple tiers by which innovation is adopted into the day-to-day care of patients. And the first tier has always been, and likely always will be, the cutting-edge academic health systems that promote innovation. It's part of their culture, it's how they think, it's how they advance their healthcare. And typically, at least in my experience, and things that I've developed as new technology, it took a decade to go from what you knew was going to change how medicine was going to be delivered. It took a decade for that technology to be adopted and used by the general orthopedic surgeon. So for dermatologic AI-driven machine learning adoption, it's probably going to take a decade to hit the community hospital. And I think the driver of it will be, number one, the marketplace shows that it actually works. It's not the clinical trial, it's the fact that everybody that uses says this works. And then the light bulb goes off in someone's head is that someone is not going to steal your lunch. You're actually going to make more money and do better by having better diagnosis. So for the melanoma, if people realize that the referrals that go to the dermatologist are going to be more precise and not random diagnoses that really don't go anywhere, then both the dermatologist who specializes in melanoma or the surgeon is better off, as well as the general practitioner, because they can now give a really good diagnosis more accurately, and the patient benefits. So, but that evolution for all of healthcare, meaning down to the community hospital, is about a decade. And I think it's just the reality. I think it may speed up. I'll tell you what I think will make it speed up is the fact that as more people in healthcare use technology in a positive way, they realize that they're more efficient, they're more accurate, the patients are better, that it'll improve over time. I think things like large language learning, where people realize they can be more efficient in their office because they have AI helping them create a note or answer an email or go to MyChart and answer something, they're going to say, this really works. Why should I not try the new technology for diagnosis of melanoma or ear-related problems or other things like that? So that's been my experience. It's about a decade in the early 2000s. Hopefully it decreases over time.
I think that in some cases also you have to be able to seize opportunities. And I mean, everybody here has been mentioning several times the tragic events of October 7. And quite paradoxically, I think that those events have been really a catalyst of a lot of initiatives in Israel. For example, there is a company, I don't think that they are here today, Gray Matters, who have developed a neuromodulation approach to the treatment of post-trauma disorder. They got FDA approval in March 2023. It was a small company. They were, of course, not expecting what was coming October 23. And since then, the company has been able to provide a unique form of treatment to a disorder which was otherwise, as you know, barely treatable, and is now actually being used everywhere in Israel and, of course, abroad as well. So sometimes there's those unique opportunities that you need to seize.
Yeah, that reminds me of a phrase of never let a crisis go to waste. You know, we saw that around 9/11. You see it from October 7th. You know, I think when people come together in a single mindset because of a crisis, innovation moves faster as a result of people thinking about it. But when there isn't that sense of urgency, there isn't that single mindset, things kind of go a lot slower.
Seeing that we are receiving strong signals from
We're
left
done
side.
already? I felt like we were just warming up.
Thank you very much.